Question number 87. It's a critical reasoning question and it says which of the following options will weaken the argument above. Then we must find out the conclusion in the argument. Now this argument says that the number of days that patients take after the operation to recover from cosmetic surgery, it has increased. So in many of the 10 largest hospitals, in fact, increased by 7 days. So patients now take more time to recover after their surgery, and based on this one data or one piece of data, the author has concluded that clearly the quality of surgical and post-surgery care is only becoming worse. So the number of days that patients take to recover, that has been taken as a sign of the decline in the quality of surgical and post-surgery care. Now if we have to weaken it, we have to show that this increase in the time taken by the patients to recover from their surgery is a positive thing, it's not a negative thing. If you look, option D is vague and it's in fact irrelevant to this paragraph because it talks about how the many operative procedures that had usually required hospital stays are simplified enough that they can be safely performed in outpatient clinics. Then why are patients staying there? So this doesn't make any sense. A says surgical and post-surgical mishap rates are the most reliable indicators of quality of medical care. So it might actually it might not weaken the paragraph, it might in fact strengthen the paragraph. But it's also irrelevant because our entire paragraph is based on the premise that the number of days that patients take to recover from their surgery. So whether there have been mishaps or there have been surgeries which have gone wrong, they do not become the part of the conclusion. B. In recent years, doctors have become more cautious and advise patients to stay in observation in the hospitals even after full recovery. Now, this can logically weaken the argument because it says that doctors simply, they take a precaution and they've asked people to stay for more time, more duration. So that's not necessarily a bad thing. So that cannot be an indicator of surgical or post-surgery care or its standard or its quality. Now C says in the last decade, innovations have allowed previously inoperable conditions to be treated successfully by major cosmetic surgery. This one will not strengthen or weaken the argument. In fact, it is beyond the scope of this argument. So the correct answer to question number 87 is B.